Hello everybody. Today we're gonna talk about COVID-19 under Trump administration and if Trump response to coronavirus was up to expectation and if still it can play its role as the world hegemon. First, let's discuss some facts about COVID-19 in the US. There are more than 986k confirmed cases, which make it the highest in the world. There are more than 55k deaths, which also make it the highest in the world. Trump made up to 33 false claims about the coronavirus. Here, there's a short, brief timeline about the COVID-19 in the US from 3 months till now. In 20 January, the US confirms its first case of COVID-19. In 29 January, the White House announced a task force to monitor, contain the spread of the virus. 30 January, the World Health Organization labels the outbreak a public health emergency. But Trump continues to downplay it, telling a crowd in Loya, "We only have 5 people. Hopefully everything going to be great." 31 January, Trump restricts travel from China, a decision that he later claims saved hundreds of thousands of lives. 6 February, 6 February, the US experienced its first known death from COVID-19 in California, though it will not be identified and reported as such for months. 24 February, the economy shows signs of free fall, even as Trump tweets, stock markets starting to look very good to me. 26 February, the Center for Disease Control and Prevention announced that a patient in California has tested positive for COVID-19, potentially the first US case where the source of infection was unknown. 11 in March, WHO redefined the outbreak as pandemic, restrict travel from Europe, excluding the UK. Days later, he announced a bar on travel from the UK and Ireland. 13 March, Trump declares a national emergency. The same day, Washington State orders its school closed. 24 March, Trump tells Fox News he would love to have the country open up and just raring to go by Easter. 12 April, he faces immediate criticism. 26 March, the US reports its first 1,000 deaths. 30 April, Trump's claim total authority over the state, saying the president of the US called the shots. He is challenged by governors who say he does not have the constitutional right to reopen the country without their involvement. 23 April, the House of Representatives approves another relief bill to help small businesses and hospitals after previous fund for small businesses fell into the hand of large companies. At the press briefing, Trump seems to suggest people might inject disinfectant as a way to fight the virus. 24 April, Trump's claim he was sarcastic about the disinfectant. The US surpassed 50,000 COVID-related deaths. Trump's briefing have shown inconsistency throughout the COVID-19 period, and the US today is paying for Trump's wrong policies and underestimation of the virus. Five lies Trump claimed as a fact. First, the United States have done more testing than any other nation by far. Figures from South Korea for the date show a total of 357 tests. If it had conducted more tests, Korea had a population of about 51 million, compared with the US, which has about 328 million. Therefore, by 25 March, the US had tested around 1 in 780 people, compared with South Korea, which had tested more than 1 out of every 150 people. Thus, by far fewer per capita in the US than in South Korea, and both countries detected the first case of COVID-19 on the same day in late January. Second, when asked about WHO data on the virus disease rate, he said, I think 3.4 is really a false number. Personally, I think the number is way under 1%. President Trump said a WHO figure of 3.4 for the uh, coronavirus death rate was false. The WHO reported this figure on 3 March and said it was based on all confirmed coronavirus cases that had resulted in death. He said the death rate appeared higher because many people who catch a mild from the virus did not report it to the doctor and therefore did not end up with, as confirmed cases. At the moment, we don't know how likely you are to die from coronavirus, mainly because of the lack of data on infections. However, scientists' current best guess is about 1%. Claim 3. On 9 March, he said last year 37,000 Americans died from common flu. Nothing is shut down. Life and economy go on. Think about that. We don't know exactly how many American deaths there have been linked to flu. A lot of people die from flu each year, as Mr. Trump points out. However, unlike most strains of flu, the spread of the new coronavirus has not been contained by vaccines or immunity from previous outbreaks, and scientists believe it has a significantly higher death rate than the seasonal flu. Claim 4. He said on 7 March, very soon we're going to come up with a vaccine. Currently, there is no vaccine for this new coronavirus, although scientists in many countries are working hard to develop one. Scientists say realistically, one won't be ready until at least the middle of next year. Testing of vaccines on animals has already started. There also been a test on human volunteers of a vaccine against coronavirus, but it will take many months before we know if it's work. Claim 5. On 29 February, we have taken the most aggressive action to confirm the coronavirus. They are the most aggressive taken by any country. The US has now imposed sweeping restrictions, some quarantine measures, but other countries have also taken aggressive measures to counter the virus in some instances. More than the US, China and Italy, for example, introduced widespread quarantining affecting millions of people. The EU has closed its external borders for at least 30 days, with some European states closing their borders to any nationals as well to any non-nationals, as well as introducing severe restrictions on movement. Reasons why Trump administration wasn't efficient in combating COVID-19. Trump has ignored impassioned calls to create COVID-19 global task force or coalition. He appears obvious to the catastrophe bearing down on millions of people in the developing world. Trump's battle against multilateralism had made it so that even formats like the G7 are no longer working. Trump's surreal televised COVID-19 briefing are further undermining respect for US leadership. Trump regularly propagates false or misleading information, beats on hunches, argues with reporters, and contradicts scientific and medical experts. While publicly rejecting foreign help, Trump has privately asked European and Asian allies for aid, even though those such as South Korea that he previously berated, and he continues to smear the World Health Organization in a transparent question for scapegoats. First, Trump administration were so slow in dealing with coronavirus pandemic. Even after it became clear that coronavirus outbreak was becoming a global threat in January, the Trump administration has been slow to prepare and react. The common refrain among experts and other and that other countries' actions, such as China, dictatorial measures, give the US a bit of time to do something, but the federal government has failed to get even the basic rights in that time. 2. Shortage of testing or testing delay. As report after report has confirmed, the US has done a bad job in this area, failing behind its developed peers in Europe and Asia. While the US has dramatically scaled up testing in recent weeks, healthcare workers and patients still complain that they still sometimes can't obtain tests even when symptoms are present. 3. If the Trump administration had prioritized outbreak prevention before the coronavirus pandemic, it might have used the time before the COVID-19 appearance or even January and February when the global threat was increasingly clear to establish possibilities in case something went wrong. A good preparation plan would be addressing that from the outset because the federal government has done before for the same outbreaks like H1N1 to Zika. A big difference from then to now is that Trump is in charge. One of the problems is Trump has consistently downplayed the coronavirus, comparing it to the common flu and claiming that his administration is doing a great job and keeping things under control. Even when announcing his administration goal to get 5 million test kits out, Trump said, I doubt we'll need anywhere near that much optimism. Trump in February said of the coronavirus, one day it's like a miracle it will disappear. In mid-March, as Trump more openly acknowledged the threat of coronavirus, he suggested that his country could pull back on social distancing efforts by Easter in just a couple weeks. When pressed why he chose the date, he did not cite any evidence or data. Instead, he said the Easter is a beautiful time, it will be a beautiful timeline. And in the case of Europe, the restrictions were likely to do little to nothing. The virus was already here since the coronavirus is already spreading within the communities. The concern is no longer the virus coming from the outside of the US. At the same time, Trump has continued to do things that conflict without experts are saying. He hyped up anti-malaria drug chloroquine. The experts say we simply don't have enough evidence for as an antivirus coronavirus treatment. He downplayed the expert, warning the social distancing may be necessary for months, instead suggesting that it may just be weeks. And instead of using press briefing to convey clear, accountable messages and let his own expert speak, Trump often uses his time at the podium to brag about unrelated issues and criticize the media as fake news. 5. A shortage of medical equipment is one of the main problems government simulations and exercises warned about before the current outbreak. 6. With the outbreak growing, the US lack of universal health care has become an even more obvious problem. If people can't get testing, they are less likely to find out why they have COVID-19 and take precautions to avoid spreading the virus. If they can get treatment in case of complication, they are more likely to suffer, potentially spread the disease and die. The Trump administration has continued to push for policies that could have a negative impact on the epidemic, including repealing the Affordable Care Act and kicking people off food stamps. The Trump administration, for its part, appears to understand part of the problem. He has signed a bill that providing economical relief to affected workers and COVID-19 patients, including paid leave, more food aid, and free testing, with more to come. But his administration has also stuck to its other efforts to kick people off food stamps that reflect the lack of priority the Trump administration has given to the coronavirus pandemic. Even as it rapidly worsens, If stopping the pandemic was the top priority, Trump could stop, even just temporarily, policies that could potentially worsen the crisis. Will the US stay the world hegemon? The US may be reaching the Chernobyl moment as it's failed to lead in combating the coronavirus pandemic. Whatever the outcome of the pandemic, nobody is today looking to Washington for a solution to the crisis. The fall in the US influence was at the virtual meeting of the world leaders, where the main US diplomatic efforts was devoted to an abortive attempt to persuade the other to sign a statement referring to the Wuhan virus as a part of a campaign China to blame China for the coronavirus epidemic. Blaming others as a diversion from one's own shortcoming is a central feature of President Trump's political tactics. US failures go far beyond Trump's toxic political style. American supremacy in the world since the Second World War has been rooted in its unique capacity to get things done internationally by by using threat or force, but the inability of Washington to respond adequately to COVID-19 showed that this is no longer the case, and American competence is vanishing. The coronavirus crisis is the equivalent of Suez and Afghanistan for Trump America. Indeed, these crises seem minor compared to the COVID-19 pandemic, which will have far greater impact because everybody on the planet is a potential victim and feels threatened. The failures of the Trump administration to lead responsibly is proving extraordinarily destructive to US position in the world. The decline of the US is usually seen as the counterpart to the rise of China, and China has, at least for the moment, successfully got a grip on its own epidemic. It is the Chinese who are sending ventilators and medical teams to Italy and face masks to Africa. Italians note that other EU states all ignored Italy's desperate appeal for medical equipment and only China responded. A Chinese charity sent 300,000 face masks to Belgium in a container in which was written the slogan "Unity makes strength" in French, Flemish, and Chinese. Such exercises in soft power may have limited influence when the crisis was over, though this is likely to be a long time coming. But while it does so, the message is going out that China can provide essential equipment and expertise at critical moments and the US cannot. These changes in perception are not going to disappear overnight. Finally, the rise or decline of the US has an economic and military power miss a more important point that should be obvious. The very real decline of the US as a global power, as exemplified by the coronavirus pandemic crisis, has less to do with the guns and money than many suppose, and much more to do with Trump himself, as both the symptoms and the cause of American decline. Democratic and rulers will, at least at first, be strengthened by the pandemic, since in times of acute crisis people want to see their government as saviors who know what they are doing. But leaders like Trump and his equivalent around the world are seldom much good at handling real crises because they have risen to power by exploiting ethnic and sectarian hatreds, blaming their opponents, and boosting their own mythical achievement. Thank you for watching.